Hi everybody, we're here to run through some PANCE PANRE tips for your upcoming tests. Some things that you really should be aware of as you prepare to and as you go through your studying. The first thing is that elephants are the key to your success, meaning that no matter how you prepare to study, make sure that you take a slow and steady pace with the fact that you have a lot of medicine to go through here and you want to eat this elephant one piece at a time. So slow steps, slow steps. So if you're using one of our programs, you know that we're doing things that way. We're breaking it down for you into those small, easy to use packets of information, and that's how we're eating the elephant. Remember that the blueprint breaks everything down into subjects, and it weights the subjects on their importance, meaning that 16% of your exam will be on cardiovascular, and 3% of your exam will be hematology, for example. So we can take a few of these and realize that about 4 or 5 of these are the most important, being cardiology, pulmonary, orthopedics, and gastrointestinal. But remember that there are questions from all sections, and ignoring sections can lead to problems down the road. But as you are triaging yourself, as you are planning your study, if you're running out of time, make sure you pay attention more to the highly weighted ones than those that are weighted less. So remember, there's a lot of questions you're going to deal with here, or a lot of information you're going to deal with, but only a few questions. So your PANCE will be 300 questions. If you're doing a PANRE, it will be 240. That's not a lot of questions given the fact that they're going to cover all of medicine. So what it means is you need to really kind of cover your bases here because you don't know what they're going to throw at you. So your goal is to get to about 80% of 80% of the material, meaning you need to be about 80% in cardio, 80% in pulmonary, etc. You don't want to spend too much time studying a few of the subjects, be very good at those, but not study the other ones at all, because questions will come your way from them. So 80% of 80%, kind of jack of all trades, master of none. That is your goal. Now, it's very important to remember that this is not a clinical test. It's not a clinical test, and there's a few different ways this is important. The primary way is that if you are a practicing PA, you know that you have seen cases where 2 or 3 of the answers likely may have happened. They could be right. They're looking for the best possible answer. Okay, so our experience can get in the way of our clinical, or I'm sorry, our test ability because of our clinical acumen. In addition, remember that newer guidelines within the last 6 months or even a year probably won't be on the test. So if you're practicing on a new diabetes guideline, don't expect to see it in the test. If you're a student, remember that what your preceptor did with you 6 months ago while you're on rotations, same thing applies as what I just said. So there's a lot more things that we have to worry about with the PANCE. So let's ask an expert. Our medical editor is Dr. Morton Diamond. He is a renowned PANCE and PANRE expert throughout the country. He's written a few books, 3 books actually on this subject, and these are some of his tips for your success. The first thing is to go over some test-taking strategies. Remember that when you have the question in front of you, read each question carefully. Be aware of the words and phrases that are indicated, such as contraindicated, indicated, preferred, initial. These are there for a reason. The test item writers are not trying to trick you. So look to those. Those are keys to get you where you need to go. Read all the responses before making your decision. Remember that you're looking for the best choice. There may be more than one that you think is right. What is the best choice? The best choice based on general medicine guidelines, not your personal experience. Do not spend a lot of time on a question. Remember, you have 1 minute for each question. 60 questions, 60 minutes in each set. Once you get to a minute, and God forbid you get to 2 minutes, you need to stop, either take a guess, because a guess is better than no answer, mark that question to come back if you have time, but do not spend excessive time on one question, because you probably won't be getting it right anyway if you don't know it, and you will not get the other ones right if you don't get a chance to answer them. You have to understand the parts of a test question, the anatomy, if you will, of a test question. It's very important. Remember that the stem is what we consider the actual words in the question themselves, and here's where you're going to find the keys that are going to get you which one is the answer, and hopefully differentiate for you which ones are the distractors. Remember that the answer is the answer, of course, the best choice. And the distractors are distractors for a reason. They are answers that either are very much off base or maybe very close to the answer, but they are not the correct answers. They are distractors. So what do experienced test writers do when they write the questions for you for the NCCPA? They're going to use certain terms that are consistent and clarify. And you have to be familiar with these in order to really do well on the exam. So let's talk a little bit about how you're going to deal with the way in which these are written. So contrary to popular belief, these are written with a specific structure. They are not written to fool you or trick you, so let's talk about it. Number one, obviously when we see anything that says that the patient has, rather than complaining of a symptom, it might mean the same thing. So in other words, 52-year-old has a 1-week history of chest pressure. It's the same as complains of. Has is the same as complains of. Remember that. If it says examination shows, it's the same thing as telling you these are the signs of the disorder. Okay? So when we see has or complains of, these are the symptoms that you need to be looking for in the question. When we see examination shows, we're looking for the signs that we need to see for this disorder. So remember those things. Remember that they're looking to force you to decide between two different things. So a lot of times there's a lot of contrast and compare in this test. There's a lot of, hey, what's the difference between these two? And a lot of times it's a subtle difference. So for example here, it may be a question like this where all of these answers have to do with hyperthyroidism. So high cardiac output, atrial fibrillation, lid lag, increased systemic vascular resistance are all in hyperthyroid states. They're all hyperthyroid states. They'll have that. But only Graves will have antibodies to a thyroid stimulating hormone. So you'll have things where they're asking you to make a subtle difference, and the distractors are all with the same disease process. So knowing the disease isn't going to help you. You've got to know that subtle difference in this case, which is the only associated with Graves, which is a specific type of hyperthyroidism. Very important differentiation here, and paying attention to that when you study. Managing your distractors. This is important. So, you know, how do you deal with what's going on? So, for example, there are many conditions in which initial management involves a medication and then a consultation. For example, 65-year-old man has sudden onset of a painful cold left arm. Exam shows left arm to be cold, pale, and numb. No brachioradial nor pulses. EKG shows a fib. Which of the following is the preferred initial management? So, yes, we're going to get a surgeon because this is a limb-threatening disorder. Yes. But the question said, which is the initial management? So be careful of wording like that. The initial management is IV heparin. The eventual management, of course, is a surgeon. So be careful there. And look for words like initial, etc., or first. And don't dive in for the fact that you saw it was obviously a pulseless limb and you were trying to save the limb by getting the surgeon involved. Assume nothing, very important. So test item writers are not trying to trick you. They're not trying to do trick questions, but there's one thing that we all can do in a question when we're taking it is we'll assume it's the case. In other words, we will project upon the question things which we think the patient has. But they're not in the question. It doesn't say it anywhere, but we believe. Now, this is something else also that can come from a lot of clinical experience, can get in the way here. So be careful. So do not project. Do not assume that the patient has diabetes if it doesn't say they have diabetes. Do not assume that they're taking a medication if it doesn't say it. What is in the question is what you need to get the answer, and that's it. Do not add anything in. This is very important. There's no clear relationship between the clinical frequency of a disease and the number of exam questions you may see on that disease state. Now, what does this mean? It means that there are zebras which are truly zebras, and there are zebras which are zebras clinically but are not zebras on the PANCE or PANRE. In other words, there are many zebra states, things that we never see or seldom see clinically, that are not zebras on this exam. They are very common on this exam or common on this exam. For example, lupus or sarcoidosis, etc. They're much more likely actually to ask you about those disease states sometimes before they'll ask you about something like COPD. Your COPD or CHF question will be about a drug or a side effect of that drug. It won't be about the disease state. But there may be one about perihilar lymphadenopathy and sarcoidosis. So it's very important that you use something that helps you understand which zebras you must pay attention to because they are not zebras in the test. And those zebras which are zebras both in the test and clinically that you can therefore push aside and not spend your time studying. Many questions are related to medications here, and so when you see that, obviously if it starts medication X is initiated, they're talking about the medicine. It's very important that you understand your medications, not only knowing just the generic name, of course, for them, but also understanding that they can be asking you counseling, side effects, interactions, disease states in which they're contraindicated. So you have to know a lot about each class. Now, be careful also to know a few medications in the class. We'll talk about that in a minute. Don't be fooled by the statement that the PANCE PANRE only consists of 3% of ID. 3% is the ID blueprint of the things they didn't put somewhere else. For example, pneumonia is not listed as an infectious disease. It's under pulmonary. Meningitis is not listed as an infectious disease. It's under neurology. It doesn't mean they're not infectious. Infectious disease is pervasive throughout this exam. We definitely graciously thank Dr. Diamond for his contribution to our product, and also, of course, to all of us in letting us feel better about what we're going to do coming up with this exam. And there's a few other things we'd like to talk to you about that we know are problems, or I shouldn't say problems, are things that you need to be aware of. That would be the fact that they're starting to describe a lot of terms, meaning that we're used to, for example, moon face, buffalo hump, abdominal stride. We're used to these terms being used to describe a cushingoid state. There's many other common terms that we always use in medicine. However, we are seeing that on the exam they're often describing them instead of saying them. Instead of moon face, they'll say rounded or full facies. Instead of buffalo hump, they'll say upper thoracic fat pad. So if you're looking at a question and you see that you don't understand what they're asking for in the STEM and you don't find the keys, look to see if there's terms that maybe you can so-called decipher. Does that sound like something else that will be familiar to you? So be careful in that case. Number 9, make sure you know the less popular drugs in a class, okay? So everybody loves the popular cheerleader. Everyone knows hydrochlorothiazide when we talk about this class of diuretics, but very few people remember chlorthalidone. Chlorthalidone is very commonly used now. Clinically, it's been proven to possibly even be a better drug. But in your test, they may ask you this. They may not ask you about hydrochlorothiazide. They might ask you about chlorthalidone. So even if you knew everything you needed to know about this class of diuretics and you didn't know chlorthalidone was in the class, you would get the question wrong. So be very careful. Know the bad boys. There are certain things, especially when it comes to drugs, that are just bad drugs. Not bad to use clinically, but the fact that there are many, many side effects or interactions or disease states you have to be careful with, or counseling things that you need to do. They love these because they can ask questions, they can't be challenged. There's a lot of information there that makes an easy question. So please be careful. Lithium and amiodarone are definitely two of our top bad boys. And they're interesting because lithium is no longer used clinically. It's kind of a zebra, but on the test it isn't. Amiodarone is now much more used clinically, and they both are something you need to know. So this concludes our tips for you to get ready for your exam. We want you to make sure you don't forget the basics. Remember to eat the elephant slowly. You need to get through this information in an easy format, using some system that breaks it down for you so you're not overwhelmed by this ridiculous amount of information you need to retain. Prep well early and rest before the exam. In other words, don't wait till the last minute. Make sure you're ready, and a few days before the exam, put the books away. Get good rest. Take it easy. Make sure you sleep the night before the exam. These are things that can make you fail even if you are prepared to be tired and not focused. Prepare your whiteboard items. You're going to get a whiteboard when you get to the exam. It's a dry erase board. You can write down whatever you want as soon as you sit down. So make a list of the things that you are having a hard time to remember. Use mnemonics and quick things that can help you write down large amounts of information. If you are using one of our programs, you know that we have a variety of things that you can use to quickly write down on your whiteboard that explain all of heart murmurs, for example, or all of the leukemias. That's really important so that when you get to that test question, even though you're nervous and things are crazy, you can look at your board and say, oh, thank God, this is what I remember, it's here for me. Practice your timing. Don't run out of time, and don't rush through the exam either. Practice your timing. 60 questions, 60 minutes. Eat well the day of your exam. Make sure that you are well rested, well fed, you feel well. It will help you a great deal. And we wish you the best of luck on your exam, and thank you for listening and participating in our review. Have a great day.